Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today, how to address social determinants of health in patients with metastatic breast cancer. Joining the show today is Niharika Dixit, a medical oncologist at Zuckerberg San Francisco General Hospital, also a professor of medicine at the UCSF Helen Diller Family Comprehensive Cancer Center in San Francisco.
The practice that I work at, because majority of our patients have many barriers to care, including health literacy, for example. They're from racial and ethnic minoritized group. And also they experience barriers such as housing insecurity, food insecurity, language barrier. So this is something that we do on a daily basis. We recognize that the guideline-concordant treatment is impacted by social determinants of health, but also it may require a little bit of tailoring in making sure that the patients get the treatment while addressing their social determinants of health that may pose barriers to treatment.
How do social determinants of health impact treatment for patients needing breast cancer care?
So I think the social determinants of health actually impact cancer care from the outset. Many patients who are a minoritized group or low income may not get access to cancer screening and are more likely to present with higher stage at diagnosis. And that means they may present with metastatic breast cancer. Oftentimes, when you have other concerns in your life, for example, if you're struggling to get housing, or if your employer does not give you time to get medical care, you may not go for your annual screening. You may skip seeing your primary care doctor and may present with metastatic disease.
What can that look like for patients?
So, for example, if you're working, not able to time take off, or have to think about who will provide childcare while you're receiving chemotherapy, whether it's for early breast cancer or metastatic breast cancer. Many of my patients work and provide care to other people. And sometimes they don't want to lose their hair because they feel that if they lose their hair, it will be apparent to their employer that they have cancer and they may actually let them go. And so many of my patients, I would choose medications or chemotherapy that would not cause hair loss, so that they're able to keep their jobs. And social determinants of health impact from diagnosis to treatment during early breast cancer. And for metastatic breast cancer, I often make choices while discussing with my patients what the best options are, but what the best options are for them, considering their ability to work or their ability to take care of their families. I also want to emphasize that it also means that we have to address some of those barriers to care while we are providing cancer treatment, because I think it's as important to address those barriers to care while you're providing treatment.
Do you have any closing thoughts to share?
I do want to say that many of the things that we do to address social determinants of health are often not covered by insurance or, for example, by health systems, not something that's included in treatment, even though it is part of your treatment planning. And so that is still a big barrier, because we should be doing this. We should be assessing for social determinants of health and social determinants of health related social needs. But who covers them, how they are covered, that's a really important question. The other important question is also that many of the patients who have barriers related to social determinants of health would not be included in the clinical trials that determine the guidelines for treating breast cancer. So I cannot overstate the importance of that addressing social determinants of health brings more patients who are from racial and ethnic minoritized group who would make our clinical trials richer and our evidence-based guidelines more generalizable.
Thank you, Dr. Dixit. You can visit the show notes for more resources on addressing disparities in cancer care. Until next time, for the Cancer Buzz crew, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.